Hi there and welcome back. I'm Kristen Galloway, a licensed occupational therapist and certified dementia care specialist. Today, I would like to talk about repetitive questions and how to deal with that kind of thorny problem that is for caregivers of your loved one with dementia, constantly asking you the same questions over and over again, which is super frustrating and annoying for the caregiver. It makes it really easy to get agitated and lose your patience. And so how do we deal with that? What's the best way to handle that? Well, the first thing is to understand that the person with dementia genuinely is not trying to be annoying. They genuinely are either confused or anxious or they're feeling unsafe or insecure. And that is the reason that they're asking whatever question it is over and over again. So for example, maybe you're in the car driving to a doctor's appointment. You've already been through the whole morning routine, got dressed, you told them multiple times that you're going to see Dr. Smith at 10 o'clock, we need to get in the car, we need to go. So you're in the car, you're driving, and the person with dementia has asked you several times, every 2 or 3 minutes, where are we going? Where are we going? Where are we going? So if this is a scenario you can relate to, this is what we're going to address in this video. So they genuinely are feeling anxious, right? So the best example I can provide for someone who doesn't have cognitive difficulty or memory loss is if you've ever been deep asleep and you wake up and have no idea where you are. It's dark, you don't know what time it is, you don't know where you are, you don't know what day it is. And that's a fleeting sensation, right? For those of us who wake from a deep sleep like that. But for the person with dementia, they can feel like that all the time. So imagine being in an unfamiliar place, seemingly unfamiliar, even though it may be an automobile that they've ridden in many times, or an assisted living facility that they've been at for several months. But it feels like somewhere that's not known to them. They look around, they don't see anyone that they recognize. They really aren't sure what time it is, what day of the week it is. If they're traveling in a car with you, maybe they don't know where they're going. So imagine how that might feel, similar to us waking out of a deep sleep and not knowing where we are. Again, that's resolved for us pretty quickly, but that person with dementia is feeling that. So imagine how insecure, unsafe, cautious, anxious they might feel. And so this is usually the reason for the repetitive questions. They are trying to ground themselves. They're trying to get some sense of comfort, some sense of stability, and some sense of safety. And so the way that we address that is to provide those feelings for them, right? And so this is through orientation. It is through facilitating a feeling of safety and giving them as much independence as we possibly can within that realm of being safe. So what are direct strategies that we can use to do these things? The first one is to print answers to these commonly asked questions on index cards or pieces of paper that you can laminate. So if, for example, they ask you continuously, where is my husband? Okay, so perhaps this is a person who is newly living in an assisted living facility or a memory center, and isn't able to live with their spouse anymore, or perhaps it's someone whose spouse has passed away and they don't remember that, right? So you can write the answer to the question on a slip of paper, on an index card, something that's a little bit durable. I like to either laminate it or put it in a page protector inside of a 3-ring binder. And so again, if it's someone who's passed away, you don't want to reintroduce that pain and that grief of loss over and over again. And so we've talked about this in some other videos. It's okay to just tell the person, that their spouse is away on a business trip, or any kind of little white lie that you can come up with that seems feasible. Visiting friends, whatever you want to use, but that can be your go-to, your standard answer. But put it on this index card, reminder binder, memory binder, whatever you want to call it, and have it available for that person all the time. So one, it can reduce the number of times that they're asking you or another caregiver that question. Two, it allows them to be independent in finding the answer to that question, and allows them to be secure in knowing that they have access to something like that. So place it in an area that's a high traffic or high visibility area. It can be on their nightstand. It can be on their side table, the chair they sit in to watch TV. It can be in like a common area on the kitchen counter, somewhere where they pass by often. Putting those answers on index cards or in a 3-ring binder. You can write it on a whiteboard. I love to use whiteboards as part of memory stations as well. We can have someone's daily schedule on there so they don't have to say, well, you know, when am I going to the doctor? When am I going to the doctor? It can be right on the whiteboard. You can have their breakfast time, their medication time, what time they have to go to the doctor, if they have other visitors coming in, if they have an activity or a special event that they're going to that day. So whiteboard is great. It can be answers to questions you can place on there. You can place their daily schedule, but again, we want to keep it in a high visibility location or a high traffic location, somewhere where you're going to see it. And I always encourage people to pick a location and keep it there. Don't move it around on them, because that will help orient them if they know that they can go to their spot to find answers to their questions, and to help with orientation. Again, helps with independence, them not having to feel like they're a burden, having to ask a lot of questions, and they know that they can go to this spot and have their questions answered. And the other way to help with reducing questions and help them feel safe and secure is to label things. And so I love to label drawers, cabinets, anything that's closed off, where they wouldn't necessarily know what's inside of that vessel unless they opened it up. So rather than having somebody, you know, tear apart the kitchen, opening all the cabinets, looking in the drawers, or in the bedroom, they're looking through the dresser and pulling open all the drawers and pulling the clothes out. You can label each drawer with, you know, these are socks, your underwear is over here. In the kitchen, we can, you know, say the silverware is here. So even though this might seem a little bit remedial, it does provide a sense of comfort and security to the person with dementia and can reduce unwanted questions. So hopefully you found these tips helpful. I would love to hear your comments. Drop me a comment below. Give me a thumbs up if you like the content of this video. Would love to hear what other videos you're interested in, what topics are difficult for you, and how we might help. And of course, subscribe to the channel so that you don't miss a single video. Thanks for joining me today.